Look, thank you for your attendance and your presentation earlier and having to wait that long time for all those votes. I suppose I'm looking at your objectives there, and then some of the things you identified as being positive developments. There's a number of reports due. The HSE, Bernard Gloucester, his review is due in a couple of weeks. Review results, Minister Butler's proposals and the Law Reform Commission. And I'm wondering, are you hopeful that out of all those reports that it will lead to proper, legislation for the adult safeguarding legislation and for the establishment of the Independent National Safeguarding Authority? Number of the issues, and I just want to pick up on, I know people have expressed already the concern that the Gardaí don't seem to have numbers around the number of complaints, and I'm just wondering why that is, because I attend my JPC meeting in my locality and they will have a breakdown of different types of crimes that they deal with, and this isn't included, and I'm just wondering why, or because we hear about data collection a lot in this committee around issues relating to disability, and unfortunately it's insufficient at best and absent a lot of the time, and it's hard to actually plan without proper data as well. So I'm just wondering why that is the case. You also mentioned that some forms of abuse are often dismissed or trivialised, and I wonder what type of abuse that is, and is that more in relation to in places like nursing homes or institutions of some sort, rather than, as you say, a lot of abuse occurs within families as well. Also, I know you mentioned deprivation of liberty. I've had occasion to deal with families where maybe the young adult, 18, 19, 20 years of age, often non-verbal, usually autistic, and maybe there's issues around, their behaviour, and it's out of frustration and not getting the proper supports. And when the families reach out looking for support, what happens is the young person is put in an institution, usually an unsuitable institution, sometimes a hospital or mental health institution, sometimes a residential, and often over-medicalised. That they're, I think you call it pharmaceutical or pharmacological restraint. And the families get nowhere to get this dealt with. If they try to make a complaint, they're more or less told, look, at the young person's an adult, if the person is non-verbal, though, the young person, they can't. And I'm just wondering if that's something that you're aware of or receive complaints about, or how, would hear, is that something that you would foresee being covered by safeguarding legislation? Also, I attended a presentation earlier today around restraint and seclusion in schools, and I know that's children, that's not adults, but unfortunately there's a lot of abuse happening within our schools as well, especially among children with disabilities. I think over 1/3 of them have actually had been secluded maybe, or being physically restrained or medically restrained, different forms of restraint used, and it's just shocking. So when you think it's happening in our schools where there is safeguarding and there should be somebody there to report this behaviour to, it's actually still happening on a large scale. And again, there's a need there for guidelines or indeed regulations around it. So it's probably in a way not surprising it's happening among adults as well, both something that needs to be highlighted and prevented. Also, in relation to whistleblowers, you often come across people maybe working in a nursing home where they witness abuse and they report it and they do the right thing, and then they end up being the person who's sort of victimised by other staff. So do you find that sometimes there's a culture within certain organisations of kind of overlooking abuse and then actually kind of backing the person maybe perpetrating that abuse? It could be maybe out of fear of that person, or that they're just a sort of a bully attitude. But yeah, no, I'll leave it at that.
The objectives, in terms of, you asked about the various publications that are due. So the HSE policy, as you know, the HSE has got an external expert to look at that, and we did speak to Jackie McElroy, who is the external expert, and gave our views on the need for that. But your very direct question in terms of, do we see that will make changes and lead to adult safeguarding? We hope. The CEO is very conscious of the need for very much developed systems and efficiencies within the HSE in terms of adult safeguarding, and there are gaps, as we said before. It's very limited at the moment, the safeguarding teams. Some go into private nursing homes, others don't. There's gaps in terms of dealing with self-neglect and other issues. So there are quite a number of gaps, and again, not in acute hospitals and things like that. So I think the CEO is very aware of those issues, and so hopefully the report will identify what needs to be done and update it. The Law Reform Commission report, we're hoping that we will see a recommendation for that National Safeguarding Authority. It's absolutely key to set the scene and to actually set out again that the whole composition of that authority is really important. So we will be asking the committee actually to pay specific regard to that need, that the legislation provides that that authority has teeth. In other words, we understand the Law Reform Commission will be making recommendations about applications to court for right of entry and no contact orders and things like that, but we need that authority with oversight on all of those issues. And also to actually have accountable to it HIQA, HSE, Decision Support Service and various regulatory bodies, and also representation from all sectors, quite a number of detailed departments. That's really important, that intersectoral, interdisciplinary, multi-participation, so you get across the spectrum. Yeah. The other issue that we have raised a couple of times with the HSE, there's no 24-hour call service. People in difficulty, we in Safeguarding Ireland have got calls out of hours and whatever, and we need a national call line for people in difficulties, and that's a huge gap. We have, again, sports bodies and other bodies or voluntary bodies contacting us, again, not within the health or social care sector, and there's a huge gap there. So. They're the issues in terms of across those sectors. I'm going to leave it to Ronan to answer the question on the Gardaí figures, but some of the others you asked about abuse being trivialised. So again, you have a lot of particularly people who may be old or frail. We did a survey about 18 months, 2 years ago, and asked the question, does another person have a right to make decisions on behalf of a person who's old and frail without their consent? And 57% of the Irish population think you can without the consent of the person, even if they have capacity. So in other words, decisions are made on behalf of people, particularly people in very vulnerable circumstances or people with disability. There would be a higher lack of respect for their rights. And also in terms of financial abuse, families think they can just manage the money or decide, pick up the pension or the disability benefit, and it's family money. It's not that person's money, and all of those personal decisions really, really important. And that's a cultural thing as well, So, and people tend, and again, the whole question back to the person where they want to be, do they wish to be in that group home or whatever, really important that their needs, their risks are all assessed in relation to that. And you're absolutely right. I mean, we again in Safeguarding Ireland, we've just commissioned a piece of research on peer-to-peer abuse, which has arisen quite a number of times. And again, we've spoken to the Irish Federation of Voluntary Bodies. They would say behavioural issues are because people can't express themselves, are unhappy and all of that. So you're absolutely right. Safeguarding care, proper care legislation should pick up a lot of those issues. And we should absolutely, I think a lot of resources are spent going round in circles doing the wrong thing rather than putting resources into a proper, effective system of adult care and safeguarding and the prevention of abuse, rather than we wait for the crisis, as you know, and then we spend huge amounts of money in legal proceedings and all of the rest, or tribunals, without actually starting at the beginning and seeing how we can put in preventative measures and safeguarding measures. So really important. I think whistleblowers, yes, again, we need very clear that safeguarding is everybody's responsibility. I said earlier about a system internally from bottom up and top down, and there needs to be a very open system certainly we're aware that, say, nursing assistants are afraid to report up the line, and again we have people that are nursing assistants that really get very little training and all of that. So there are huge issues around that, and that leads to lack of reporting or lack of even being afraid to report. And many people that are the victims of abuse or lack of safeguarding are afraid because they may be dependent on other people. But it's up to the rest of us to watch out for that, recognise it and raise awareness about that. So Ronan, you might talk about some of the figures.
Yeah, no problem at all. Thank you. Like obviously there are Garda figures that come out on crime, but the issue that I was referring to there is that on the one hand you have HSE Safeguarding Office figures that report annually on cases of alleged abuse, and that break those down into different categories, such as I referred to earlier, online abuse or emotional abuse or psychological abuse, which would be the main types. The Garda figures, in terms of like what we promote, is that if there's an immediate or serious safeguarding concern, that person go to the Gardaí. If there's an ongoing complex familial situation, that go to the social work service in the HSE. But what we're unable to do is have kind of parallel reporting of information that you could join the Garda and the HSE figures. They're just different sets of figures really, and how they're recorded and what they signify is different. So that again leads to the point that we're saying, to get an overall picture of the level of abuse, that if you had under the jurisdiction of the Safeguarding Authority collecting in an overall sense, then we'd get a picture of what the level of abuse in the different categories in an overall sense is, and obviously you'd be able to monitor that over time as to what the changes are, what areas legislation or enforcement should focus on. So it would be trying to gather in an overall sense really would be where we'd like things to go, I guess.
Okay.
And if I could just add to that in terms of the Gardaí, again, they want very specific evidence to be able to prosecute, whereas in fact we should be sharing information at an earlier stage. I'm involved with SAGE advocacy, and we see a number of times where a person whose capacity is at issue, maybe their money has been stolen or their bills not paid or whatever, and the Gardaí say, oh, they lack capacity, they don't even try to interview, even though the advocate may have very clear evidence of financial abuse. So again, we need the Gardaí to be very aware. They have an obligation to follow that, even though it may not lead to a prosecution. But if abuse, even at whatever level, is taking place, it should be followed through on.